The mission of the Raphael Community Free Clinic is to minister in a caring and Christian environment to the medically underserved of Kerrville and the surrounding area.
I can't afford to go anywhere else.
So you can come here.
Yeah. My husband passed away on me, and my son is watching over me, and
She doesn't drive. I'm the only one
I
that
can't
drives.
drive, so I don't have much choice, and I ain't getting much Social Security to live on.
See y'all later.
Why Raphael?
Raphael is the angel of healing in the Old Testament.
So it means God heals.
And we just thought that was as appropriate as it can be.
It took somebody with vision like Sister Marge and Sister Mary Ann to come into a community and just say, this is what needs to happen and we're going to do it.
There is a gap in health care. It's a very real gap that impacts patients and their families. It's a gap between those who have insurance and those who don't qualify for medical coverage sponsored by government.
The vast majority of the folks in that gap are working individuals. They are either employed full-time with somebody that's not able to provide benefits, particularly small businesses, or working several part-time jobs, or are self-employed, and just they don't qualify for anything.
Really?
Serving with us at the clinic is a host of volunteers with a heart to fulfill the health needs of those less fortunate, the chronically ill, the working poor, and the young mothers.
Why does Peterson Memorial Hospital support the Raphael Clinic? We see patients coming to the emergency department when it's not necessary. That provides very expensive care, and also it's disconnected. The Raphael Clinic provides continuity of care for patients and their families in a more appropriate setting where it's not an urgent problem, but maybe a chronic problem where they need ongoing assistance.
For the vast majority of these people that are unfunded, they don't have any way to receive any type of preventative care at all. And so they generally, when they present, they present to the emergency room and they present in crisis. Probably the most inefficient and clearly the most expensive place to pay for any medical care is in the emergency room.
Yes, thank you so much.
It's very cost efficient for the medical community because it's a lot easier to take care of healthy people than sick people.
They have saved my life, and I don't think I could have managed it without them.
Among our volunteers are the physicians who come to our clinic and who remain on call as we need them.
I think that it's important in any profession to give back to people as a whole, and it makes you a better person, it makes you feel more fulfilled, and you get out of it a lot more than you give into it.
Volunteer radiologists from the Hill Country Imaging Associates read x-rays for us. And our Peterson Memorial Hospital provides free medical imaging and labs.
Sister Marge and Mary Ann, they see an enormous number of patients every day and are able to provide a very high level of care for these folks. And I think we've been very lucky in this community that we've got a group of doctors that are willing to support them, and they're out there on the front lines every day, but they're able to pick up the phone and have built a network here in town to access people when they have a question, have a problem that commonly we can help them with just over the phone, or if not, we'll get them in the office and we'll see them. But you know, what they do on a day-to-day basis is just amazing.
Critical to our mission at the clinic are the volunteer nurses.
What do you enjoy about volunteering at the Raphael Clinic?
I enjoy the patients and being able to help them and help them understand their health care needs.
Filling hundreds of prescriptions a week, volunteers in our pharmacy provide a vital service to our patients.
Been here for 10 years. 10 years.
From the first day.
Wow.
Raphael Clinic, good morning.
Running a medical clinic requires people at the front desk, on the phone with patients, speaking English and Spanish, maintaining the medical records, documenting financial needs, or completing the paperwork for the drug companies.
I enjoy working at the clinic.
Oh, it's
You always work with very pleasant people,
yeah.
and also the patients are very, very appreciative, exactly.
Based on the success of what we've done as a community, other free clinics following our model and blueprint have been seeded elsewhere.
What they've really been able to accomplish is to show other communities that while it looks like a task that's just, we can't possibly do that, you can. We got, sorry about this, Marge, we got two little nuns that came in and took off on a Goliath type task and have pulled it off. And it gives other people in other communities hope and inspiration to do it. So again, we're very fortunate.
In the words of our Blessed Mother Teresa, it is not what you do,
but how much love you put into doing it.
Janabelle, you like coming here?
Yeah, I like her.
You like her?
Yeah, I like her for my doctor.
She is a pretty good